Caldwell Esselstyn is famous for saying heart attack proof. So aside from the research for you and Dr. Montgomery, what's happened in the last 15 years to all the whole food plant-based people you've seen? In other words, the people of the last 1,000 people that you've seen between the two of you, how many of them said, okay, I'm eating a whole food plant-based diet 15 years ago. What happened to them? Did they have heart disease? Did they have stroke? Did they have erectile dysfunction? Or they ate a great diet and lifestyle and they didn't get it? Like, forgetting about all the research, what's happening in the real world? Do regular people who follow your advice sometimes get heart attacks and strokes and erectile dysfunction, or not?
Yeah, I'll answer and then we'll leave it for Dr. Montgomery. I am completely convinced that the most powerful recommendation is to change your diet to a diet without processed food that's either largely or completely colorful plants. I eat an only plant diet, but I also honor some research by Dr. Walter Longo at the University of Southern California and others that certainly get credit in the nutrition world. There are other lifestyle interventions like sleep, like stress management, like quitting smoking, like some fitness. And when you combine them all, it's powerful. I would not call it bulletproof as a guarantee. I've seen people doing it right and have that next event, even a cardiac arrest they had to be resuscitated from. Usually we can identify it. It's usually lipoprotein A. It's usually a gene called NP21. It's usually maybe some inflammation from a source we didn't realize, a hidden infection under a root canal that was driving their C-reactive protein up. So, I mean, I monitor blood work like crazy. And if you give me that person and their blood panel's benign, their high sensitivity troponin is low, their panel of inflammatory markers is within normal range, I'll give you a pretty long-term bet on that person. But if it's not that way, I'm digging, and I think I'll just give one last statement. A lot of plant-based eaters are very deficient in omega-3. They're trying to get their flax, their chia, their hemp, or they're not, or they can't convert it. And you can measure it. So I measure it in my plant-based eaters. I measure it in the others too. And I really educate. That's probably when I spend more time than, that would surprise people, going over omega-3 source foods to cool down the inflammation using targeted nutrition.
Yeah, I agree with pretty much what Dr. Kahn is saying, because it's pretty tricky. So if you make the blanket statement that if you're on a whole food plant-based diet, you're bulletproof, you can miss a lot of people. I've seen a lot of people who come into my office and they fly in from all over the country and they say, well, I'm whole food plant-based, SOS, et cetera. And they'll have advanced cardiac disease, they'll have abnormal inflammatory markers and the like. One has to be very precise, and our approach is one. And when I use the phrase the food prescription, because not only do we look at the fact that I'm pretty sure that plant foods are superior to animal foods. I think the data supports that and the like. So then when you say within the context of eating plant foods, what foods are you eating? Because someone could be eating a whole food plant-based diet, quote unquote, but in my book, if they're microwaving their food, if they're sauteing, if they're overcooking things, if there are a lot of preservatives in it, et cetera, these foods may not be ideal. That's one. Two, it depends on what level of illness that person's in. We get patients with end-stage heart failure, with atrial fibrillation, who are in the ICU, managing patients with both liver dysfunction, renal dysfunction, kidney dysfunction. And so in these patients, it's not just a matter of a whole food plant-based diet. I put them on raw detox with time-restricted eating. We do intermittent fasting with time-restricted eating, sauna therapy. There are other therapeutic interventions that we have to give, targeted supplementation. We have to look at the omega 3 to 6 ratios, look at inflammatory markers. We look at lipoprotein A, we look at ultrasensitive troponin, et cetera. So for our patients who are at advanced heart disease, we do an integrative care approach. And I've got a patient with amyloid cardiomyopathy who has an ejection fraction of 20-25%. He's getting better. He's on a raw diet. When he was eating a whole food plant-based diet with some cooked foods, he had some problems. So we had to advance his diet more, plus add other things. And so you have to be very precise when you're dealing with patients with advanced disease. And yes, the diet matters, but you have to be very precise with the nutrition. And people with more advanced disease need a more advanced nutritional therapeutic intervention. So that's why we have our own nutrition center, our own restaurant, our own food preparation in our center, because we have to control the food. And I think in the world of medicine, we have to be very, very precise in how we use nutritional intervention. Just to say whole food, plant-based, and you're done is not enough. If you're starting from a normal individual in utero and eating natural whole food, plant-based, and it's from the garden, et cetera, that's going to make a big difference. But you've had experts on this very program talk about whole foods that are not necessarily whole foods. There may be GMO products, foods that are grown across the country and shipped and gassed and high. So these foods are not ideal. So many of the foods we get out of the supermarket, they may be in cans, they may be preserved in different ways. So we have to be very, very precise in the foods we prescribe our patients. And in our center, we use locally grown, sustainably grown, organically grown produce that we get to our patients in a minimally processed manner, especially our sicker patients. And I think that part has to be overemphasized. So if patients on a pristine plant-based diet with time-restricted eating, intermittent detoxing with some other interventions added, I agree with Dr. Kahn. We have to follow the biomarkers very closely, very carefully to see how their body's responding to this therapy. In that situation, those patients do well. But just to throw blanketly say your whole food plant-based, I'm not so certain about that. And I don't think we can apply a bulletproof guarantee to just that recommendation.